Now let's move into a real-life scenario where adaptability was key to a hospital's success. We'll look at how staff at Central Valley Hospital adapted to the sudden introduction of telemedicine during the COVID-19 pandemic. At the height of the pandemic, many hospitals, including Central Valley Hospital, needed to find ways to continue patient care without in-person visits. Their solution? Implement a telemedicine platform that allowed doctors, nurses, and other healthcare providers to conduct virtual consultations. But as with any rapid change, the transition didn't happen without challenges. Let's break down the challenges they faced. First, there were technological barriers. Many of the staff struggled with learning a completely new system. For doctors and nurses who had spent years in face-to-face care, adapting to a virtual environment wasn't easy. Next, communication gaps became apparent. Staff members found it difficult to maintain the same level of patient engagement through a screen. Many patients also felt distance from the process, literally and figuratively. Finally, there was a significant amount of resistance to change. Some staff, particularly those who had been in the field for decades, were skeptical of telemedicine and preferred the in-person care they were familiar with. So how did the hospital respond to these challenges? First, they quickly organized training programs to help staff learn the new platform. IT support was on call to assist with technical difficulties, ensuring no one was left behind. They also set up feedback loops, weekly meetings where staff could voice concerns and suggest improvements. This gave everyone a space to share what was and wasn't working. Another key step was patient communication training. Staff received guidance on how to maintain engagement and rapport with patients during virtual consultations, a skill that wasn't as intuitive as in-person interactions. And finally, the hospital implemented incentives for early adopters. Staff who embraced telemedicine early were recognized and rewarded. This helped motivate others to get on board. What were the results? After a few months of continuous improvement and adaptability, Central Valley Hospital became a leading example of successful telemedicine integration. The staff grew more comfortable with the technology, patient satisfaction levels increased, and both patients and staff adjusted to virtual care as the new normal. This was a perfect example of how adaptability in the healthcare setting, even under intense pressure, can lead to success. Now, I'd like to hear your thoughts. Given this scenario, how could adaptability have been improved during the initial rollout of telemedicine? What other strategies could the hospital have used to support staff during this transition? I'm looking for volunteers to share their insights. So, as we've seen, being adaptable to change, whether it's technological, procedural, or organizational, is critical to the success of hospitals and healthcare teams. It's not just about surviving a change, but thriving through it, just like Central Valley Hospital did with telemedicine.